Hello, hello, hello. How you guys doing? Oh my God, can you guys believe it? It's day 15. Week 3 is almost over. I can't believe it, guys. I'm so looking forward for tomorrow's test. But first, we have to go through today's webinar. All right. Before we go into today's webinar, some of you guys have been messaging me some questions. We'll go over them real quick so that everyone would benefit from that. First off, HbA1c, right? For diabetic patients, especially patients who type 1 diabetes patients, HbA1c normal value 4 to 7. Okay, 4 is not low, 7 is not high, 7 is borderline, 4 is borderline. So do you need to do any intervention? If a question asked you, if they said HbA1c is 4, are you going to do any interventions? The answer is no. Okay, the patient will stay on the same regimen. Awesome. Let me minimize this. So the second question, someone was telling me, ECG rate. How can you tell the ECG rate on a 6-second strip? What do? We discussed this. You multiply by 3. My bad. You multiply by 10, right? So if it's 6, you have 6 QRSs in a 6-second strip, ECG strip. What do? You multiply 6 by 10. So the heart rate is 60. If you've got 7, you multiply 7 by 10. 7 QRSs times 10, heart rate equals 70. If you have 7.5 QRSs, okay, 7.5 QRSs, and in the options, you've got 75. What do? You choose 75, right? Because 7.5 times 10, 75. All right, verbal orders. Do you take verbal orders during, in a hospital setting? You do not take verbal orders. Verbal orders are prohibited only in one case. If there is a critical situation, meaning if you are in a code situation, there is a cardiac arrest. Okay, if there is a cardiac arrest, then if a physician gave you a verbal order, he said, give adrenaline 1 milligram IV push. What do? You give adrenaline 1 milligram IV push, right? If the physician said or provider said, give atropine 1 milligram IV push, then you're gonna give atropine, right? So verbal orders and critical situations or code situations are permitted. So let's take that out of the way. Other than that, you do not take verbal orders. What do you take? Phone orders. Yes, phone orders are allowed. All right, what do you need to know about verbal orders? Only RNs can receive verbal orders. Only RNs can receive. You guys, do you guys see the screen? Can you guys hear me? Someone give me a yes down in the comments. Can you guys hear me? So you've been hearing me for the past 2-3 minutes or just now? Okay, awesome. Alrighty, so let me see. We were talking about phone orders. You can take phone orders. Only RNs can take phone orders. LPNs, UAPs cannot take phone orders. Okay, so phone orders are given by a provider to the RN. They will call the RN, they will give an order. The RN will receive the order, will write down the order on a piece of paper, and then they will sign off on the order, like date and time, and then they will read back the order. Okay, so 3 steps. Write down, sign off, meaning date and time, and then read back the orders. So if you got a question, select all that apply. That's what you're gonna choose. And then the provider has 24 hours to come to the unit and sign those orders. Okay, only 24 hours. So if you got 48 hours, are you going to choose that option? No. So it is write down, sign off, and read back the orders. Okay. So that all you need to know about phone orders. And then let's see. And then you've got, let's say, you've got a patient who is cyanotic and unconscious. You went to the room, the patient is cyanotic and unconscious. What do you do first? You call for help. Do you check pulse? No, you call for help. Do you check um, breathing? Do you check airway? You don't. You call for help first. So if they're asking, what do you do first? Then you call for help. Then you come back to the room, you check for pulse, you adjust the airway, meaning you do the head tilt chin lift to adjust the airway, then you start your compressions. All right? That's the algorithm. You don't need to know that, but at least you need to know what do you do first. Okay, if you saw a patient, he's unconscious, he's cyanotic, immediately you call for help, then you come and perform BLS. All right, and then let me see what other questions you guys sent me. So that was it. Let me see. Cohorting patients. Okay, you only cohort patients if they have the same disease, not the same precaution, the same disease. So let us say you've got a TB patient and you've got a meningitis patient. Both of them are um, both of them are um, what is that? Both of them are airborne, right? Do you put them in the same room? No, you don't put them in the same room because they have different organisms. And if you put them in the same room, then the patient who has meningitis will have tuberculosis. So you do not put them in the same room. You put them in separate rooms, and you only cohort patients if they have the same disease. Both of them have tuberculosis. Both of them have meningitis. Both of them have varicella. Okay. Alrighty, let me see. CT scans and MRIs. All you need to know about CT scans is that it's with contrast or without contrast. If it's without contrast, then that's fine. You don't need to double check anything. Okay, just make sure that you don't have to do anything. If a patient has a CT without contrast, you don't have to do anything. If a patient has a CT with contrast, then you need to make sure that this patient had a creatinine level checked. Okay, if his creatinine is fine, then you can go ahead and give contrast to the patient. What do you need to check other than the creatinine? Allergies. You want to make sure that this patient is not allergic to contrast. All right, and keep an eye on food allergies like fish and egg, because iodine has because fish and egg has some iodine in them. So you want to make sure that the patient is not allergic to fish and egg. MRI. What do you need to know about MRI? You only need to know if the patient you only need to check if the patient has any metal components in his body, meaning does he have a artificial heart valve? Does he have an artificial knee, artificial hip? Did he do a total knee, total hip in the past? You know, and does he have like staples? After surgery, the patient has staples, and they want to perform like MRI to the brain. All right, so he did craniotomy, MRI to the brain, a craniotomy. He has staples, and they want to perform MRI to the brain. They cannot unless they remove the staples. So anything that has metal in it, you need to be careful that you do not perform an MRI while the patient has metal. Some pacemakers are not MRI safe. Okay, so you need to pay attention. If there's a pacemaker, you need to ask that question. Is this MRI safe or not? Okay, so just keep it in mind. Let me see. So basically, I guess that's it. If you guys have any questions, any other questions that you encountered during the day, just let me know. WhatsApp me, or on the Facebook group or Facebook Messenger, wherever we talk. Just put them over there, and we will discuss them. But I mean, like, if there's something that you need to know about any disease that you encounter, if you have curiosity, just Google it. You don't need to grab a textbook. All right, if I'm working and I'm looking at a patient chart and something came up, some disease, some sign that I do not understand, I just copy and paste it to Google and check what does that mean. I don't need to ask the doctor, or ask my colleague, or ask a clinical educator. I can check with Google. So always check with Google. If there's something that you checked, you did the research and you didn't understand, just hit me up, let me know. I'll be more than happy to answer you. All right, so let's go. I'm gonna share my slides, and let's start this webinar. As always, I would like to welcome you to the live NCLEX webinar, the ultimate algorithm to pass your NCLEX on your very next attempt. There are people who made it, people who made their dreams come true. I want to see you one of those testimonials. I want you to believe that you will pass on your very next attempt. So the road to become an alpha slice is bumpy. It's not easy. It needs hard work. It's never meant to be easy. Today, an Egyptian nurse was calling me. Actually, he was messaging me on Instagram, and he was saying, "Hey Mo, like, I have a lot of options. I have an option to go to the States. I have an option to go to Canada. I have an option to go to Australia. What do you think? What do you suggest?" I mean, like, me, I'm looking at this message. I was saying, what the heck are you talking about? You have options? You don't have shit. What options are you talking about? Like, is the some people, if they are nurses, they think that immigration doors are open for them just for the fact that there is nursing shortage all over the world. No, it doesn't work that way. It's hard. You need to study. You need to put the hard work. You need to pass your NCLEX. You need to do your paperwork. You need to pass your English. There's a lot of there's a lot. The process is long. Okay, that's what I mean. The process is long, but you need to start somewhere. Don't be overconfident. Don't be overconfident. Don't be delusional that things are easy. No secret recipe. You need to put the hard work. There are things you need to memorize. There are things you need to study, things you need to repeat, go over it over and over and over. All right? Just like bodybuilding. If you're trying to build muscle, you need to do the reps. You need to make a lot of repetitions, bench press, squats, and then you build your muscle when you do a lot of reps. Same thing for the NCLEX. For you to memorize stuff, you need to repeat them over and over and over, right? Let's jump to the first question. A home care nurse, by the way, today's webinar, we're going to go ahead and solve some questions. You've got some pictures. We're not going to review slides from the past. There are new information I want to discuss with you guys. We're going to talk about, as I promised yesterday, a few slides about labor and delivery in terms of complications and how do you intervene, how do you act, what actions do you need to do. And then we've got some slides regarding chest tubes. All right. Let's see the first question. A home care nurse visits a clinic. Oh, my bad. A home care nurse visits a client undergoing external radiation therapy after a lumpectomy. Lumpectomy. This should be a B, I believe. Lumpectomy of the right breast. Which statement made by the client indicates that the nurse's teaching is effective? All right, I'm going to read it again. The home care nurse visits the client undergoing external radiation therapy. So they're doing external radiation therapy after lumpectomy of the right breast. So just keep in mind, it's the right breast. Which statement made by the client indicates that the nurse teach is effective? So basically, which statement is true? You've got 3 wrong statements and 1 true statement. Number 1, I should wear a loose-fitting bra made of 100% cotton. Number 2, I can apply scented lotion to the right side of my chest. So the surgery is on the right side. So they can apply scented lotion. Scented lotion means a lotion that has an odor. Number 3, I should expose my right breast to the air and sun. Number 4, I can apply cold compresses to the right side of the chest. What do you guys think? Do we have answers? Immediately, you just start by cancellation, all right? You understood the question, you understood your keywords, then you try to cancel 2 options. All right, what do you guys think? All right, awesome. All of you got the right answer, which is amazing, but we're gonna go through them and because I want to explain them, all right? So the correct answer is number 1, as all of you guys have answered 100% cotton because you do not want any irritation, okay, with the breast or chest, especially because it's exposed to radiation and you don't want that friction because you don't want to break down the skin, okay? And loose fitting or baggy clothes just to minimize that friction. Alrighty. So let's see, number 2, you never use lotion, okay? Just tell the patient, do not use cologne or perfume, do not use scented lotion, do not use deodorant, do not use any product under your armpits or your chest or in that area that has external radiation, okay? Just make it clear to the patient. On the first visit, you just explain to them that you cannot use anything, not a perfume, not a deodorant, nothing. Number 3, I should expose my right breast to the air and sun. That's not true. There's no need. So here maybe the patient is implying that the area should be dry or whatever, but you do not have to expose the area to air and sun. Number 4, I can apply cold compresses to the right side of the chest. You do not apply cold compresses. You do not apply hot compresses. You do not apply extreme temperature. You just keep it neutral, okay? Alrighty. This very next question, you're supposed to answer it wrong, okay? But I'm gonna give you a piece of information. Just keep it in mind. There's one thing you need to memorize in the next question. Let's see. The nurse provides care for a client diagnosed with early stage chronic kidney disease. So early stage chronic kidney disease. Which assessment finding does the nurse expect? Anuria, oliguria, polydipsia, polyuria. And I hope by now everyone knows these terminologies, these medical terms. Everyone knows what anuria is, oliguria, and polydipsia and polyuria. All right, let's see. What do you think is the correct answer? By the way, we do not have a lot of attendance today, so whoever is attending, I would like to thank you from the bottom of my heart. You are a hard worker. Alrighty. Do I have answers? All right, so the correct answer is actually number 4, polyuria. I know, you're gonna get surprised, right? You're gonna say, oh, what? It's chronic kidney disease. How come? The patient should have either anuria or oliguria, right? Most of you answered the second question. I'm not kidding. I'm totally serious. The right answer is polyuria. Polyuria occurs early in the condition as the kidney becomes unable to concentrate urine. If untreated, it will lead to dehydration or severe dehydration. Okay, so this is a keyword, early stage of chronic kidney disease. All right, so you're gonna see this question once and you're gonna memorize it. Anytime you see early where is that? Early stage chronic kidney disease. Okay, just think of polyuria first. The kidney just got an injury. It's just going into a chronic phase, chronic kidney disease. So in early stages, polyuria, and then a patient will get dehydrated, either oliguric or anuric. Okay, it's actually an NCLEX question, so just keep it in mind. Okay, let's move into I believe, a delegation question. The nurse assists in the care provided by the LPN for a client who had a mastectomy. Does everyone know what a mastectomy is? Does everyone know what a mastectomy is? You just have to put yes in the comments. Does everyone know what a mastectomy is? Okay, awesome. So, so the nurse is assisting the LPN to take care of a mastectomy patient. The client has a wound drainage evacuator in place. Which observation concerns the nurse? Okay, so the patient has wound drainage evacuator. Which observation concerns the nurse? Number one, the LPN secures the drainage evacuator to the client's gown without applying tension on the drainage tubing. Try to visualize those options. The LPN, and in California, they call the LPN LVN. So I just threw it out there. LVN, licensed vocational nurse. Okay, LPN, licensed practical nurse. So number two, the LPN fully compresses the drainage evacuator with one hand while replacing the spout plug with the other hand. Number three, the LPN uses an alcohol wipe to clean the drainage evacuator spout and plug prior to reestablishing the vacuum. Number four, the LPN releases manual pressure on the drainage evacuator after the plug is in place and the unit rapidly inflates. What do you guys think? You can read them again and make up your mind. I'm gonna give you a few seconds. What do you guys think? I'm gonna read number four again. The LPN releases manual pressure on the drainage after the plug is in place. Releases the manual. Oh, I see. And then the unit rapidly inflates. Okay. What do you guys think? Do I have answers? All right. All right. I'm gonna give you a couple more seconds to answer. All right. Okay, awesome. So the correct answer is actually number four. Okay. The correct answer is actually number four. Let's go over them before we go on, and let's go with number one first. So the LPN secures the drainage evacuator and the client's gown without applying tension on the drainage. You can do that. Okay. You do not hang the drain with the bed linen. Okay. You do not hang the drain with the bed linen. Why? Because if the patient wants to go to the bathroom and they forgot that the drain is attached to the bed linen, then it could be pulled off. Okay. So attach it to the patient's own clothing. That's fine. Sometimes they attach it to the elastic stockings or TED stockings. All right, number two, the LPN compresses the drainage evacuator with one hand while replacing the spout plug with the other hand. That's applying negative pressure to the evacuator. By the way, drainage evacuator is the JP. If you guys remember, we discussed the JP before. It's the same thing. So with one hand, you compress it, and with the other hand, you close the plug. So you apply negative pressure. That's true. Number 3, the LPN uses alcohol wipe to clean the drainage evacuator spout and plug prior to reestablishing the vacuum. Okay, which is fine. The patient, the LPN is wiping to minimize infection. Okay, decrease the risk of infection. Number 4, when the patient press the JP or the drainage evacuator and then put the plug and then the unit rapidly inflates, that indicates air leak in the unit or in the JP. There's an air leak. That requires the nurse to call the physician and secure the leak. Sometimes it's just you find the leak and you just need to tape it, put a tape over it, and sometimes the whole drainage will be replaced. Okay, either removed or replaced. Okay, tension is pressure. Where is tension? Which option there's tension? Oh, first option, applying tension on the drainage tubing. It means applying pressure, because you do not want to block the tubing of the drainage. You want it to free flow. Alright, so this is actually the JP or the wound drainage system or reservoir. It collects blood, and then this may be, I'm not sure what this surgery is, but anyways, so the JP is there, and you drain the blood. After you drain, you just press it. You press it with one hand, and with the other hand, that plug over there, you close it. Okay, and that will be negative pressure. If it inflates right away, that means there is a leak. Could be a leak right there, could be a leak in the plug, could be a leak in the tube. So you just find where is the leak and then you tape it. Alrighty? So I'm not gonna go over delegation to LPN. You can read them on your own. Admissions, IV medication, IV bag with electrolytes, IV push medication, starting an IV, blood transfusions, central lines, plan of care, patient education, unstable patients, first of anything, verbal orders, nothing. Okay? All right. The nurse instructs a client who is prescribed furosemide. Furosemide is Lasix. Which client statement indicates that additional teaching is required? So basically, which is the wrong statement? There are 3 true statements and 1 wrong statement. I will take my medicine early in the day. I will contact the doctor if I feel dizzy. I'll take my medicine with meals. I will avoid orange juice and bananas. Which statement is wrong? What do you guys think? If there are true statements that you 100% know they are true, just cancel them. Okay, we are looking for the wrong statement. What do you guys think? Come on, give me some answers. Do you guys have answers for me? Awesome. Awesome. Okay. So I guess most of you got the right answer. This should be easy. Number 4 is the correct answer. Just for the fact that Lasix will excrete a lot of potassium at the same time. So the kidney will excrete water and potassium at the same time. So you need to replace that potassium. You encourage the patient to eat bananas and drink orange juice. We're gonna have the slide. We're gonna see the slide of potassium-rich food. Okay, you can tell the patient to eat whatever from that menu, just to increase their potassium a little bit. So number one, I will take my medicine early in the day. True. Usually patients take the Lasix early in the day. If they take it in the afternoon or late in the evening, then all night they will not sleep. They will keep going back and forth to the bathroom. Okay. Number two, I will contact the doctor if I feel dizzy. So that's a true statement. Okay, if it's true, you cancel it. We are looking for the wrong statement. So whoever answered to your mind played games on you. Okay. So I contact the doctor if I feel dizzy. That's true, because most probably you are dehydrated. Number three, I'll take my medicine with meals. True. Take your Lasix with meals in the morning. Number four is the wrong thing, because you do not avoid orange juice and bananas. You need to eat orange juice and bananas. Okay? All right. And for those who really got the right answer, that means that your mind is sharp. Okay? You're reading carefully. You're picking up on every keyword. Okay? Awesome. The nurse reviews circumcision site care. Okay, the nurse reviews circumcision site care with the parents of a newborn client. The newborn was circumcised with a clamp. Which statement by the parent to the nurse indicates that teaching is successful? So what is the true statement? There are 3 wrong statements and only 1 true statement. Number 1, I will wipe off any discharge that appears using warm water and a gentle circular motion. I will wipe off any discharge that appears using warm water and a gentle circular motion. 2, I will put petroleum jelly on a gauze and put that over the penis before I diaper him. 3, I will be sure that diaper fits snugly, but not too tight, so that it is changed when wet. 4, I understand that it is normal for the first few days that the penis to look red and swollen. What do you guys think? So I'm looking for the correct statement. Just keep that in mind. When you choose your option, you ask yourself this question: is this correct? We are looking for the correct statement. Do I have answers? Read them carefully, and then I'll give you a couple of seconds to answer. Since we are a small group today. Oh, some people joined us. Oh, my bad. My bad. Alrighty. Do I have answers? I'm gonna give you 5 more seconds. Alrighty. So the correct answer is actually number 2. But we're gonna go over all of them. All right. I will wipe off any discharge that appears with warm water and a gentle circular motion. You don't do that. Okay. If you wipe discharge, that discharge is actually the granulation tissue that will form normal tissue. So any yellowish, whitish discharge that appears on a second day or third day, that is the granulation process. So you do not wipe it. you do not wipe it with water, warm water, or gentle circular motion, because you are wiping the new cells. Okay, so just leave it as it is. If you're having any signs of infection, like number four, after first few days, the penis looks red and swollen. These are signs of infection. Then you need to report it right away. All right. So number one, you do not remove normal tissue, because these are like, they call them granulation tissue, new tissue that will heal the circumcision site. And number four, you report signs of redness and swelling. That's not normal. Number three, I will be sure that the diaper fits snugly. No. When you change a diaper for a patient, you always want to put the diaper loose but secure. Okay, you want to tape it well, but keep it loose. All right. So number two, yes, on a circumcision, you put petroleum jelly. And some of you guys, if you don't know what a petroleum jelly is, it is Vaseline. And I'm gonna have a picture on the next slide to show it to you. So you put Vaseline on a gauze, you apply it to the penis, and then you change his diaper, okay? Or you put the new diaper. Alrighty. So this is actually the Vaseline. I guess everyone knows it. This is the petroleum jelly. Alrighty. When performing abdominal thrust to remove a foreign body, the client becomes unconscious. Which actions are appropriate for the nurse to implement at this time? So a patient choked on something, and then you're applying abdominal thrusts to remove that foreign body that he choked on, and then the patient becomes unconscious. What do you do? Select all that apply. Begin chest compressions. Look in the client's mouth for a foreign body. Insert an oropharyngeal airway. Open the patient's airway using a head tilt chin lift maneuver. Activate the emergency response system. What do you guys think? What do you guys think? Give me your options. Okay. Do I have options? Do I have answers? Let's go, guys. Let's go. Right, I'm gonna give it a few more seconds. I want everyone to participate, because if you're participating, then you're challenging yourself to get the right answer. If you got them wrong, then you would know that you need to change a little bit your thought process. All right, awesome. Let's go. Actually, only number 3 is wrong. The others are correct. Okay. Definitely you begin chest compressions. You look in the patient's mouth if there's a foreign body, because you have been doing abdominal thrusts. So you look in a patient's mouth, maybe that foreign body is out. So you take it out. Your index finger, you shape it as a hook shape, and then you insert it in the buccal area of the patient's mouth, and then try to hook that foreign body and remove it. And then you perform chest compressions, of course. You do not insert anything in a patient's airway, okay? Anything. Because if you put anything in a patient's airway, you're just advancing that foreign body inside the lung. And then if the foreign body is advanced more inside of the lung, then it will block one of the lungs, usually the right. 4, open the patient's airway using head tilt chin lift. That's true. You open the airway. You do not check. So this is a misconception. If an NCLEX question said head tilt chin lift to check for a foreign body, that's wrong. Okay. You open the airway by the means of head tilt chin lift. Okay, you look for a foreign body by opening the mouth. Okay, and then the last, activate the emergency response system or team. That's correct. Okay. No, if you just open the mouth and look, that doesn't mean that the foreign body will go deeper. You just open the mouth and look. But if you insert something in the mouth, yes, you can push the body deeper. Okay, and if you want to remove the foreign body from the mouth, if you visually can see it and you want to remove it, you can try. Insert your finger as a hook and try to remove the foreign body. Okay. The nurse provides care for a client following a tracheostomy. Which action will the nurse take to prevent dislodgement of the tube during this time? Let's see. Select all that apply. Perform tracheostomy cleaning and care every 24 hours. So this is the question you need to ask yourself. Will this prevent dislodgement? Yes or no? Number 2, ensure that the same size or larger tube is at the bedside. 3, wait at least 24 hours to change the tracheostomy ties. 4, maintain the client in a semi-fowler position at all times. And number 5, suction the tube when there is a moist cuff or hypoxia. What do you guys think is the correct answer? What prevents dislodgement? So when you pick your options, you ask yourself, does this prevent dislodgement? Let's see. What do you guys think? Do I have answers? All right, I'm gonna give it a few more seconds. Okay, I'll wait on one more answer and then we'll reveal the correct answer. Alrighty. So actually, the correct answer is 3 and 5. Okay. So number 3, wait at least 24 hours to change the tracheostomy tube. The ties, yes, that prevents dislodgement. Because if it's fresh, you don't want to mess up with the tracheostomy because it's still like slippery. So you keep it tied for 24 hours and then you can perform a tie change. You change the tie with your tracheostomy care. Okay. And number 5, suction the tube when there is moist or hypoxia. Yes, that prevents dislodgement. Okay. You don't want to suction the tube every time the patient coughs or every time you hear something. So only when there is a moist cough, which means that you can hear the secretion, you can hear that the secretions are bubbling inside the trach, or hypoxia, the SpO2, the oxygen in the patient's body decreased. So it was 98% and now it's like 93. Then you go ahead and suction. Otherwise, you don't mess with the trach. Same thing with the ET tube. You don't mess with it unless there is hypoxia or you can hear the secretion. Okay? And the rest do not actually play a role. Perform tracheostomy cleaning and care every 24 hours. You usually do every 8 hours. Okay? You don't do every 24 hours. But even though 24 or 8, that does not prevent dislodgement. Ensure that same size or larger is at the bedside. Again, that is like a safety thing for emergency cases, but that does not prevent dislodgement. Number 4, maintain a client in semi-fowler position at all times. That does not prevent dislodgement. And actually, when you perform the tracheostomy cleaning or care, you lower the patient's bed to a supine position. All right. The nurse learns that a new admission was responsible for the death of a neighbor during a robbery. So basically, during a robbery, the thief killed the neighbor. And then the thief is your patient. The nurse says to the head nurse, I do not think that I can care for that client. Which is the best response by the head nurse? I will talk with the supervisor about your situation. Number 2, I can see about transferring you to another unit. Number 3, please share with me your concerns. Number 4, you are a professional and you will care for the client. What do you guys think? Obviously, there's like an ethical dilemma here, but what do you guys think is the perfect answer? Try to use cancellation and try to use therapeutic communication. What do you guys think? Awesome. So whoever answered so far got the right answer. Most of you got the right answer. So the correct answer is number 3. So to talk to a supervisor regarding the situation, I mean, the head nurse can take care of this issue. She doesn't have to go to the supervisor, right? She does not have to go through a chain of command. Staffing on the unit and assignments can be taken care by the charge nurse, but if there's like an ethical dilemma, the head nurse will take care of it. Okay. Number 2, there's no need to transfer. So this looks like a punishment. Oh, you cannot work with your patients, we'll transfer you to another unit. So this looks like a punishment and it's not necessary. 3, yes, please share with me your concerns. The head nurse is addressing the patient's concern or fear, and she's asking for more information. She's asking an open statement, or she's saying an open statement to allow the nurse to ventilate and talk about the situation. Number 4, you're a professional and will care for the client. This is like an authoritarian leadership, and it doesn't work in this situation. Okay, so you've got to keep in mind that nurses are human, and you empathize and sympathize with them, and you never allow a nurse to work in an assignment that she's not comfortable with. I read it. The nurse provides care for a client receiving carbidopa, levodopa. Which statement, if made by the client's spouse to the nurse, indicates the medication is effective? Okay. Number 1, my husband has gained 2 pounds in the last month. 2, my husband gets fewer upper respiratory tract infections. 3, my husband's tremors have disappeared completely. 4, my husband is better able to walk around the yard. If you know what levodopa or carbidopa is, then you will definitely answer this question correctly. And that's why the next slides we're going to explain levodopa. If you know what levodopa is given for what disease, then you will definitely answer this right. Okay. I'm gonna wait for one more answer and then we're gonna jump into the. Okay. So actually the correct answer is number 4. And some of you got it right. So my husband is better able to walk around the yard. So levodopa or carbidopa help reduce rigidity and bradykinesia. Kinesia means movement. Brady means slow movement. And if you know Parkinson patients, levodopa and carbidopa are given to Parkinson patients. And Parkinson patients have slow movement or bradykinesis. So if the patient starts walking around the yard, that means that the levodopa is working. This action facilitates mobility, which is the therapeutic outcome of the client taking the medication. Okay. So gain 2 pounds, that's not the indication, or that's not the how levodopa works. It does not make you gain weight. It has nothing to do with respiratory infections. And what's that? Tremors. It does not disappear tremors. Okay. All right. Because levodopa is not a cure. It will not cause the tremors to disappear. Okay. As we said, Parkinson is a progressive disease. It doesn't have a cure, but you can only control symptoms. So the bradykinesis or bradykinesia is a symptom of the Parkinson, and you can control it. And levodopa actually, or carbidopa, is a dopamine promoter. They work on dopamine receptors. It can treat Parkinson's disease, signs and symptoms. I should have put here signs and symptoms. So Parkinson's symptoms include tremors, stiffening, and slowness of movement. All of these, or all of those, are caused by low dopamine. Okay, Parkinson's disease, it's a low dopamine. So the way you improve symptoms is by giving dopamine to the patient. So when you give levodopa to the patient, levodopa is not dopamine, but when it's introduced, or when it goes into the blood, it transforms into dopamine. So dopamine, a natural substance usually found in the brain. Levodopa is in a class of medication that works by being converted to dopamine in the brain. Okay, so those slides with the previous question is actually, I don't want to say that all you need to know about Parkinson, but if you've been reading the notes, then you should know this information by far. Okay. All right, let's move. After insertion of central catheter, CVC, central venous catheter, the client suddenly starts coughing. The nurse observes that the client is pale and dyspneic and has tachycardia. Which action does the nurse take first? Number 1, turn the client to the left side and lower the head of the bed. 2, notify the healthcare provider. 3, administer oxygen. 4, instruct the client to do a Valsalva maneuver. What do you guys think? First, you need to analyze the subject of the question. So if you understand what the subject of the question means, then you can try to guess the correct answer. So basically, whenever you put a central line, so after insertion of central line, client suddenly starts coughing, then there's two options. Then there's 2 things that might have happened. Okay, so the patient he's pale, dyspneic, and tachycardic. You either mobilized a clot, or so like a clot, it went to the lung, and now the patient is dyspneic, pale, and tachycardic, or you introduced an air emboli. So what do you think? Let me see. All right. Awesome. All right, some of you got the right answer, but I'm not sure if you got the right answer because you knew that this is an air emboli. Well, let's see. Correct answer is number 1. You turn patient to the left side and lower the head of the bed, because this is an air embolism. And what you need to do is put the patient on his left side. And if you can imagine, if you put the patient on the left side and lower the head of the bed, it's like you have an air bubble in a bottle of water. The air bubble will go towards the highest side of the bottle, right? So if you put the patient on the left side, then that embolism will not go into the heart. it will stay in the superior vena cava. Okay, if you put them on the left side, lateral position, lower the head of the bed, then that emboli, air emboli will stay in the superior vena cava. Okay, just because of the pressure, it will stay in the superior vena cava. And in that way, you can either allow it a little bit of time for the buffering, for the blood to buffer that air emboli, or it should be surgically removed. So they put like they will do a coronography or angiogram, and they will see where that blood clot is, and then they will introduce a wire and try to remove that clot. Okay, but in most cases, if you just allow it a little bit of time, around half an hour, then the blood will buffer that air emboli. Okay. Let's see, Valsalva maneuver. If a patient is having tachycardia, you ask them to do Valsalva maneuver. Usually they put their thumb in their mouth, they close their nose and try to blow and push downward. That's a Valsalva maneuver. Okay, that will increase intrathoracic pressure and will lower the heart rate. Notify the healthcare provider. Well, yes, notify the healthcare provider, but you do not want to pass the bucket. You want to intervene. Administer oxygen will not help. And number 4, yeah, we talked about all the options. I'm gonna show you guys a picture. This is a picture actually of an air emboli. So this is the air bubble, and it will go into the lungs, and it will cause a pulmonary embolism or a PE, because it will block one of the veins. So what you need to do, you need to keep that bubble in here with the in the superior vena cava or inferior or what's that, interior vena cava. So you need to keep it in the vena cava right here. Okay, you need to keep it in the systematic circulation. You don't want the bubble to go inside the heart. So if you put the patient on the left side, if the patient lies on that side, then the bubble will go up. It will stay up just because of gravity and pressure. Okay, then if you give it 30 minutes, it will buffer, blood will buffer it. All right. So the volume of this bubble could be 2 mLs. 2 mLs of air can cause the patient to have a PE. Okay, it's that serious. You cannot let air into the circulation. So air embolism, we're going to talk about signs and symptoms. They will have breathing difficulty, chest pain, confusion. So these are symptoms of air embolism. Treatment, how do you treat it? Usually it's supportive care. You put the patient on his side and let the blood buffer the air embolism. So supportive care, you send the patient to the hospital, you put him on oxygen, and removing air from the heart and high pressure chamber. So high pressure chamber, I'm not sure why I put that there, but so you just surgically remove through a procedure like angioplasty or something, you remove the air from the heart or whatever that air is. The perfect position as well for air embolism situation is Trendelenburg position. The face up and the feet, or the face down and the feet higher than the face by 15 to 30 degrees. Okay, that will allow the embolus to go towards the internal organs like kidney or liver, or towards the peripheral circulation like the limbs, hands and feet. Okay, and as well, because of the position and gravity, and the pressure will go up, pressure of the air will go up. Ready? All right, let's move on. The nurse instructs the client about trimethoprim sulfamethoxazole. The nurse needs to intervene if the client makes which statement? Select all that apply. So this medication is very popular. You need to know it. It's very popular among immunosuppressed patients, HIV patients, or oncology patients. So we'll talk about this drug, what it is, and what does it do. So select all that apply. Number one, I am being prescribed this medication because I have a bacterial infection. 2, I should take the medication with food. 3, this medication is safe during pregnancy. 4, I should notify my healthcare provider if I develop nausea or abdominal pain. Number 5, I should wear sunscreen while taking this medication. So basically, when we get questions like this, we're talking about specific medication. So what you need to do, you need to memorize those. Like when we move to the second question, what you need to do after the webinar is you'll have in the notes like this drug, but you need to get back to the question and memorize what are the things that are true or are correct about this drug or are wrong about this drug. So what do you guys think is the correct answer? You know, on your NCLEX, you'll get a lot of medication question. So during the webinar, we're gonna cover 99% of those medication. So literally, if you memorize the medication that we discussed on the webinar, you are in good hands. You'll be in a safe spot. All right. So let's see. So someone got them completely the opposite. And I think your mind is playing games on you. Got them completely the opposite. So what the nurse needs to intervene if the client make which statement? So I'm looking for wrong statements. Alrighty. So the correct answer is 2 and 3. I should take the medication with food. No, you should take the medication on an empty stomach 1 hour before your meal every morning. Okay. And by the way, trimethoprim sulfamethoxazole. These are 2 antibiotics, and the name of the drug, like the brand name, is Bactrim. Bactrim. Bactrim is an antibiotic, and it's given prophylactically. It's given prophylactically for pneumocystic carinii pneumonia. Okay, PCP, pneumocystic carinii pneumonia. So it's so they are given prophylactically. Prophylactic means prevention. Before it happens, we're giving the drug to protect the patient from you know, the infection. All right. So let's see. So number 2, I should take the medication with food. That's wrong. You should take it on an empty stomach. Number 3, this medication is safe during pregnancy. No, this medication is category C. Okay, and it's not safe with pregnancy. 4, I should notify the healthcare provider if I develop nausea and vomiting, abdominal pain. Yes, with all antibiotics, you will have diarrhea, nausea, and abdominal pain. So you notify your physician. Yes, they are expected signs and symptoms, but still you will notify your physician. I should wear sunscreen while taking this medication. That's totally true because of photosensitivity. This patient has a photosensitivity side effect. Okay. Let's see. Alrighty. Let's move to the next question. Oh, what is that? Let me see. I think I messed up the slides a little bit. Let me fix them real quick. Nope. Let me see. Just bear with me, guys. Just 1 second. You know what? Let's take a 3-minute break. I'll fix this slide and then we'll come back. Okay? Alrighty. So now it's 10:03. Let's come back after 4 minutes at 10:07. I'm gonna mute my mic. Alrighty, guys. We are back. Thank you for those who are participating in the polls. Whenever I launch a poll, they jump right away and answer it. 63% so far answered that poll. 75%. Okay, I'm gonna close it right now. I'm gonna share the results with you. And let's see, share results. All right, so 75 of you answered this poll. 67 said yes, they are reading their daily notes, and 33% said 50-50, which is fine as long as you are understanding the webinars 100%. Okay, as I said, the notes are complementary to the webinar. So if you need quick access to information, or if you're solving a question and then the question is talking about Parkinson and you want a quick definition about Parkinson, so instead of going to Google, a faster way to learn everything you need to know about Parkinson for the NCLEX is reading the notes. Okay, I highly advise that you read the notes. For those who are sometimes like 50-50, okay, I'm glad that there's there's no one who's not ever reading the notes. Okay, for those who said 50-50, can you tell me in the comments? Only me can see the comments. Okay, if you don't want, like, you don't feel comfortable, that's fine. If you can tell me in the comments why. I know some of you have jobs, are busy, time. These could be like excuses why you're not reading the notes. Alrighty, let's move on. Gonna share my slides with you. Alrighty. The nurse instructs a client. Oh, we already did that. Okay, the nurse teaches a female client with a family history of hypertension. Which recommendation does the nurse include in client education? So basically, a patient has hypertension. Limit sodium intake to 2 grams or less daily. Exercise at least twice weekly. Avoid use of tobacco products. Limit alcohol consumption to 1 serving per day. Limit coffee consumption to 2 servings per day. So what is a true statement? I am looking for true statements. What do you guys think? I hope you get this right by now, because we talked about hypertension so many times in the notes. At least 4 webinars, I talked about different information about hypertension. All right, do I have answers? All right, I'm gonna give you 5 more seconds. Okay, awesome. Yeah, I see some correct answers. Alrighty. All right. Give you 2 more seconds. You want to put an answer? Alrighty, let's go. The correct answers are actually 1, 4, or 1, 3, and 4. Okay. Number 2, exercise at least twice a week. You know, usually with hypertension patients, the American Heart Association recommends exercising daily. By daily, they mean 5 days a week. Okay. They say we are not like, with hypertensive patients, you do not say like weight-bearing exercises or resistance training exercises. You just say, be active for 30 minutes, 5 days a week. So 30 minutes a day for 5 days a week. It could be walking, jogging, running, any cardiovascular type of exercise. Okay, it could be a treadmill, elliptical, walking around the block. It could be anything for 30 minutes every single day. Okay, so 5 days a week. That's the recommendation by the American Heart Association. So let's see. Number 5 is wrong. No, coffee is never a bad option. Okay, coffee is never, or coffee here is a bad option. Let me see. Include in the also, you do not include coffee. 2 servings daily. Usually they limit them to 200 milligram, which is 1 cup of coffee. Okay, so that's it. It does not spike the blood pressure, but so let me see. What did I put in my notes? Okay, so coffee is not a risk factor for hypertension, but limited to 1 cup a day. Okay, American Heart Association, basically they would like exercises 5 days a week, 30 minutes a day, any sort of cardio exercise, and limit caffeine to 200 milligram a day, which is 1 cup. All right, 1 serving. So obviously these are new information for you. So whoever picked them, they didn't know the information. I didn't know either, but so tobacco, you cannot smoke tobacco. So you cannot smoke tobacco if you have hypertension, because tobacco or smoking is a risk factor for hypertension. So avoid it. So avoid is correct. That's a correct statement. Okay. Alrighty, moving on to the next question. The nurse provides care for a client who had a hypophysectomy. Who knows what a hypophysectomy is? I believe we discussed it once on previous webinars. Does anyone know what hypophysectomy is? Does anyone know what hypophysectomy is? You can just say a yes, or you can tell me what hypophysectomy is down in the comments. Let me see. I want one person to, okay, awesome. Awesome. All right, guys. So it is surgery for the pituitary. It's removing the pituitary gland. So sometimes it's posterior hypophysectomy, sometimes it's anterior hypophysectomy. That means anterior pituitary gland or posterior pituitary gland, or it could be the whole pituitary gland. So the nurse provides care for a client who had a hypophysectomy. The nurse observes clear drainage coming from the client's nostril, from his nose. Which action should the nurse take immediately? Test the drainage for glucose, document the drainage, lower the head of the bed, obtain a culture of the drainage. What do you guys think? For those who have experienced in medical surgical or have encountered this information before, you definitely will answer the correct answer. Let me see. I'm gonna wait a few more seconds. Awesome, you guys. Everyone who answered got the right answer. It is number 1. Usually your concern is CSF leak, cerebrospinal fluid leak, and usually to tell if the secretion is mucus or CSF, you do a AccuCheck, just like the glucose check for diabetic patients. You do an AccuCheck. If there is a glucose, if it shows glucose, then that's CSF, because CSF has glucose in it. If it doesn't show any glucose, then That's most probably mucus. Already? So hypophysectomy, for those of you who didn't Google it the last time or you don't know the surgery is actually done through the nose, and they go through the sphenoid. They call it like sphenoid, which is the basal bone of the brain or of the cranium. It's right there. They call it sphenoid, and then they remove the pituitary gland right there. Okay, and your primary complication or concern should be to observe for CSF leak. Sometimes if a patient is sleeping and which actually this is what I put in the question, right? The patient is sleeping and observes clean drainage coming from the okay. So sometimes if a patient is sleeping and they wake up, sometimes their pillowcase has rings of uh, yellowish rings on their pillow. Okay, and this is a sign that those rings are due to CSF leak. All right. Alrighty. So as we said, okay, let's move to the next question. The nurse on a bone marrow transplant unit receives a call from a coworker who reports that 2 days ago, his spouse was possibly exposed to tuberculosis at work. Which is the best response by the nurse? Okay, so on a bone marrow transplant unit, the nurse received a call from another nurse who works on the unit saying that his wife or her husband was possibly exposed to tuberculosis at work. So what is the best response? When did you have your last TB test? What were the results of your last TB test? Has your spouse ever been given or has your spouse ever been exposed to TB before? Are you concerned that you may be infected with TB? What do you guys think? What do you guys think? What do you guys think? Let me see. All right. All right. Well, all of you answered the same answer, which is a long answer. Most of you chose number 3. Has your spouse ever been exposed to TB before? So what does that piece of information benefit me? Okay, if yes or if no, what does it mean? Exposed. So if the wife was exposed to TB before, what do I do with that piece of information? I don't do anything. She was exposed to TB before. That doesn't mean anything. Okay, I'm talking about now. Now she's suspecting that she's exposed to tuberculosis. Okay, if she had tuberculosis in the past and she took treatment and she recovered, then that does not mean anything. I want to know if the patient now is exposed to TB. So number 3 is wrong. Okay, so the correct answer is actually number 4. Okay, you want to address the nurse's concern. You want to address his concern. Is he afraid that he might be infected with TB? So that's what you need to ask. Okay, you might be confused between number 1 and number 4. Okay, number 1 and number 4, I would accept that. Number 1, when did you have your last TB? Okay, you might say you might be looking if the patient would be infected or not. You want to make sure that he was vaccinated. Okay, but I do not ask this question unless the patient is tested positive. Okay, if the patient is tested positive for TB, then I would ask this question. All right. So it's not relevant to the exposure of his wife. Alrighty. So I would address this concern. Now I'm gonna have a few slides about tuberculosis and treatment. So treatment of tuberculosis is actually for antibiotics. They are isoniazid, rifampicin, pyrazinamide, and ethambutol. Okay, so 4 drugs: isoniazid, rifampicin, pyrazinamide, and ethambutol. Okay, you need to know those drugs. Rifampicin, one thing you need to know about it is it turns the patient's urine orange, pink or orange. It turns the patient's urine pink or orange. All right. So how long is the treatment? The treatment is over 6 months. Okay. But after a few days, the patient will have no symptoms, will be asymptomatic. But they need to take the treatment over 6 months. Some of the medications, some of those antibiotics are given over 2 months, sometimes over 4, and some of them over 4, and some over 6 months. But the whole treatment is 6 months. Okay. Side effects of this treatment: patient could have fever for 3 or 4 days, and as I said, after a few days the patient will be symptomatic. Okay. Pain in lower abdomen, that's normal. Itching or rash, that's a side effect of those treatment. Nausea, vomiting, and anorexia. And then yellowish skins or eyes, jaundice, dark or brown urine. But as I said, with rifampicin, sometimes it's orange. All right. And of course, fatigue. You can also have tingling, burning, numbness in the hand and feet. So what do you call it? Does anyone know what is this called? Tingling, burning, and numbness in the hands and feet. It's called peripheral neuropathy. Okay, peripheral neuropathy. So basically, that's all you need to know about tuberculosis, in addition to the precaution, like airborne precaution. So it's that easy. It's laid out for you. All the answers are going to be from this slide. So I hope that you familiarize yourself with it. All right, moving on to the next question. The nurse prepares a client for a left total hip replacement. Which statement by the client indicates to the nurse that the client exhibits an emotional readiness for surgery? So what statement by the client implies, yes, let's go and do the surgery? Number 1, I know the healthcare provider isn't telling me everything, but there is nothing I can do about it. Is this addressing the readiness for surgery? Number 2, I've never heard of this specialist before. Does this healthcare provider do much work here? Is this addressing readiness for surgery? So automatically you can cancel, like you can start canceling options. Number 3, I'm glad the trapeze, or however you want to pronounce it, but I just pronounce it trapeze. I'm glad the trapeze is here so I can start working on my exercises as soon as I wake up. Or, can you please check my chart? I'm not sure that other nurses recorded that I am diabetic. What do you guys think? I'll give it a few more seconds. Awesome. All right, do I have more answers? I would like everyone to participate. Are you watching TV and watching this webinar at the same time? Already. Readiness for surgery means that the patient is motivated to do the surgery and recover after the surgery. Okay, so basically it's number 3. So number 1, that doesn't mean that the patient is, that means that the patient is doubting the provider. He's doubting his sincerity and his truthness. But that doesn't mean that a patient is ready for surgery. And number 2, same thing, that the patient is underestimating the orthopedic major or specialty. Number 3, the patient is ready for recovery. Like he's saying, I'm glad trapeze is here, so I'll start doing my exercise as soon as I wake up from surgery. That's what this means. As soon as I wake up from surgery. Number 4, can you please check my chart? This doesn't mean that he's ready for surgery. He's worried that they didn't document that he's diabetic. Okay? And I'm gonna show you what some of you some of you might not know what trapeze means. Do you guys know what trapeze means? Just give me a yes or a no down in the comments. Do you know what a trapeze means? Okay. All right, so I figured that some of you didn't know that trapeze is like a post-op care. Okay, that facilitates mobility and physical therapy or exercise or mobility. So some of you said yes, some of you said no, but basically this is a trapeze right here. That's the trapeze where the patient can hold into it and maybe pull himself up, sit up a little bit, or sit on the side of the bed. Basically, it helps them mobilize in the bed. Okay. Sometimes they slip down and they want to adjust their posture so they can hold to the trapeze and pull themselves up. Okay. That's a trapeze. Alrighty. The nurse prepares the client for a barium enema. And some of you might have misconception about barium enema, and we're gonna explain it. Because someone texted me and they were saying they had false information or misconception about barium enema. But at any time, guys, if you're reading information or you're reading the notes and there are some words that you think you might misunderstand them, just Google them, okay, or ask me. I'll be happy to address it to you on the personal level and then include it in the webinar to explain it to everyone. Because the question that you might have, a lot of people might have it as well, okay? So the nurse prepares a client for a barium enema. Which instruction is most important for the nurse to include? Number 1, your stool will be light color for 2 to 3 days after the test. 2, once the test is over and you go to the toilet, you'll be able to resume normal activity. Number 3, the X-ray table will be titled, so you can assume various positions. And number 4, during the test, it is crucial that you take slow, deep breath through your mouth. So what do you guys think? If you know barium enema, you can guess. But I think it would be very hard for you to guess the correct answer if you do not know what a barium enema is. Because literally, if you know a barium enema, you might get the wrong answer as well. Alrighty, let's see. What do you guys think? So maybe a couple of information are true, a couple of options are true. You might have only one wrong answer, but what is the most important? What is absolute must that the patient should know? What do you guys think? Alrighty. So the correct answer is actually number 4. Number 4, during the test, it is crucial that you take slow, deep breath during your mouse. So for the test to be successful, the patient must retain the barium. So the barium is actually an enema given through the rectum. And for the physician to be able to see the whole colon, the patient should keep that barium in his intestine, so that the barium can migrate through the intestine, and the physician will be able to visualize, or the technician will be able to visualize the colon on the X-ray. And maybe you don't know what I'm talking about because you don't know what a barium enema is, but the next slide I will explain it, okay? I promise. So, and like if you have given, or if you know anything about an enema, like a regular enema, if you give it to the patient, then the patient cannot hold it for long. Usually you tell the patient to hold it for 5 minutes or 10 minutes, but usually patients cannot hold more than 10 minutes. They will have cramps and they feel that they want to go, okay? So slow deep breathing will help the patient ease the discomfort and the urge to let go, all right? So basically number 1 is correct, but that is not the most important thing that you want to tell the patient, all right? And number 2, once the test is over, you can go to the toilet, you'll be able to resume normal activity. So usually when the rectal tube is removed, so rectal tube, you put a rectal tube, and the bag of enema will be hooked through a catheter to the rectal tube, okay? And then you will give the enema. So when the rectal tube is removed and the patient evacuate the bowels, the patient will still do more X-rays, like pre and post, to see if that. So usually they perform this to see if the patient has some kind of obstruction with stool. They call it fecaloma. Fecaloma, from feces. Feca, from feces. Okay, and most patients after the procedure, they just want to rest. Okay, they just want to lie down, or sit down, or sleep a little bit. They do not go to resuming normal activity. All right. And number 3, the X-ray table will be tilted so you can assume various positions. That's not true. Usually they try to put the X-ray table in a Trendelenburg position just to facilitate that that enema to go inside into the colon. All right, and all of that will make sense once you see the picture. So this is the picture, guys. This is how you put the patient Trendelenburg position. You elevate the legs for 15 to 20 degrees above the head. And if you see here, there's a rectal tube and it's connected to a catheter. And this is the bag of enema, okay? And then you give the enema to the patient. And then if you see the second picture, the colon will lighten up, okay? The colon, because it's a barium enema. So it has barium in it. So the colon will lighten up, and that's why you tell the patient to hold on and breathe slowly, because you want that barium to go all over if you know the anatomy, there's rectum here, and it goes up the sigmoid, and then up into the colon, this transverse colon, and then it will go down the descending, or this the ascending colon, and then it will go, you've got the appendix right here and the cecum area, and then it goes to the small intestine. So because the patient has been holding for 10 to 15 minutes, it allowed the barium to migrate all over into the small intestine. And if you allow it to stay here for a longer time, then it will go up to the duodenum and then to the stomach, and everything will light up. Okay? But our target is actually the large intestine. You want to look for fecaloma. Okay? So any dark spots, so if there are dark spots here that there is that the barium cannot pass, that means there's something obstructing it. Most probably it's going to be fecaloma. Okay, so you always position the patient like that. Every time you hear about barium swallow, we are assessing for fecaloma. See this picture right here, all the black spots, these are fecaloma. Okay, these are stool, and they do not lighten up on the barium. Okay, so just keep that in mind. You're gonna have a rectal tube, you're gonna have the enema, and you're gonna ask the patient to try to hold on as much as possible. Alrighty, let's move to the next question. So the nurse provides care to a client who is believed to have developed tuberculosis. So this patient has tuberculosis. The nurse implements which steps when collecting the client's sputum specimen? Okay, select all that apply. Use a suction catheter to obtain the specimen if needed. Ask the client to spit into a sputum container. 3. Offer oral care before collecting the sputum specimen. Number 4. Send the specimen to the laboratory immediately. 5. Collect the specimen in the evening or before bedtime. What do you guys think? So if there's an option that you're 100% sure that it is true, just keep it. The ones that you're skeptical about, keep it for the second round when you read the options again. Or if you're sure that this is wrong, just cancel it right away. And this is what I actually do when I'm practicing. I'm gonna show you guys when I'm practicing. Literally, this is what I do. Okay, let me see. Come on, what's that? Oh, it's here. Okay, I'm gonna show you guys. Let me show you. This is what I actually do. If I'm literally solving questions, this is what I do. I read the, so this is a keyword. I say tuberculosis is a keyword, and then collecting sputum. Okay, I want to collect sputum. So use a suction catheter to obtain the specimen. Oh my God, you've seen the right answers. My God, Mo. Anyways, so I'll keep that. I'll say maybe. Okay, ask the patient to spit into a container. I know that's wrong. Okay, especially with TB, you don't want patients to be spitting sputum here and there. Number 3, offer oral care. Yeah, I will keep it because like you don't want like oral saliva or mucosa or whatever. You want just to go inside and deep tracheal aspirate. That's what they call it, deep tracheal aspirate. So if the patient had food in his mouth, or he hasn't cleaned his mouth for a while, you need to ask him to. You will offer oral care or toothbrush or whatever. So number 4, send the specimen to the, yeah, definitely. You don't want it to sit on the unit. Okay, collect the specimen in the evening. No, usually you do it in the morning. Okay, if the order was put in the evening or at night, then you keep it to the next morning. Okay, so basically that's how I do it. Like, I mark stuff, I cancel stuff, I highlight keywords. When I'm studying, I do that, so that on the real NCLEX test, that will be my second nature. I can do that in my mind. Okay, all right, let me clear that. Alrighty, guys, let me see. Gonna share the slides again. Did anyone answer? Oh yeah, I got some answers. All right, well, now you know the right answers. But so this is how you collect. You need deep tracheal aspirate, and you never ask the patient to spit. You don't want them to like contaminate everything. Okay, and what you're looking for, you're not looking for spit, you're looking for sputum. Okay, all right, let's go. All right, During a home health visit, an older adult, Asian American, client reports nausea and anorexia since taking isoniazid. Okay, if you remember, isoniazid is treatment for tuberculosis. So he's been taking isoniazid for 4 months. Which action will the nurse take first? So the patient has been having nausea and anorexia. So number 1, obtain a sputum specimen. 2, inspect the heart palate. 3, assess skin color on the abdomen. And 4, instruct the patient to stop the medicine. What do you guys think? What do you think is the correct answer? So patients report nausea and anorexia since starting the isoniazid. What do you guys think? Do I have answers? Let me see. Okay, I have a couple. Does anyone want to answer? Just take your best shot, okay? Okay. All right, so actually, correct answer is number 2. So what you're looking for is you're looking for hepatotoxicity. Why? Because isoniazid causes hepatotoxicity. Okay, it's excreted through the liver and it might cause hepatotoxicity. So what are you looking for? What signs and symptoms are you looking for uh, hepatotoxicity? You're looking for jaundice. Okay, and since the patient is Asian American, okay, so most probably his skin is yellow, and you cannot tell if this yellow is from the jaundice or not. So where do you look for jaundice? Is it the skin? No, it's not the skin. So number 3 is wrong. Is it? So number 1 is wrong because you already know that the patient has tuberculosis. So there's no need to take another sputum specimen. So number 2, inspect the heart palate. And number 4, instruct the patient to stop the medication. No, you don't. Okay, you don't ask the patient to stop the medication. So it is inspect the heart palate. Okay. Number 2 is the correct answer. So due to biocultural skin variation, because he's Asian American, and you know, like when they gave you Asian American, either they are throwing you off or they are giving you a tip. So you need to analyze that before jumping into the answers. So signs of early jaundice are best observed on the posterior heart palate in people with Asian descent, just because of their skin color, it's yellow. Okay, even the sclera might contain yellow pigmentation. All right, so that's good to know, right? So drug-induced hepatotoxicity, or sometimes they call it drug-induced hepatitis, okay, is a side effect of isoniazid. So the patient will get hepatitis from medication. Alrighty. So does anyone recognize this drug? The nurse provides care for a client receiving sulfamethoxazole trimethoprim. Which observation indicates that the client is experiencing a common side effect of this medication? Does anyone recognize this medication? Does anyone know what is the brand name? I just mentioned it maybe like 30 minutes earlier. That's Bactrim. Okay, Bactrim is a common antibiotic that is given for patients with low immunity. Yes, Bactrim with low immunity. It's very common through HIV patients and oncology patients. So any patient who has low immunity, you give them Bactrim as a prevention prophylactic for PCP, pneumocystic carinii pneumonia. Okay, that's a bacteria that causes pneumonia in immunodeficiency patients. So now we're looking for common side effects of Bactrim. What do you think? Hypotonia, loss of hearing, hypotension, or urticaria? Do you guys know what urticaria is? Do you guys know what urticaria is? Yes? Awesome. Okay. So what do you think is the side effect? Yes. Yes. What do you think is the side effect? What do you guys think? All right, I'm gonna give it, oh, everyone answered. Okay. So the correct answer is actually number 4, urticaria. Urticaria is a side effect of Bactrim. Okay. So the patient will have mild or moderate rash, which is a common side effect of Bactrim. Okay. All right. So here you see that it is urinary tract anti-infective. So it's an antibiotic. It could be given as a treatment for urinary tract infection. But I always want you to keep in mind that Bactrim is given for PCP, which is pneumocystic carini. Okay. But I also want you to know that urticaria is one of the side effects of Bactrim. Okay. Loss of hearing. Why did I put that there? Because definitely I want to tell you that this is an antibiotic, but I wanted to see if you're gonna mix this antibiotic with mycins, aminoglycosides. Okay, so aminoglycosides or mycins, they cause ototoxicity, which is loss of hearing. Okay, but Bactrim is not a mycin. All right. So hypotonia, which is weakness of the muscles, hypotension, low blood pressure, urticaria, which is mild rash. Alrighty. The nurse prepares to discharge a client after an abdominal cholecystectomy with a T-tube in place. Does everyone know what cholecystectomy is? Like when we say cholecystectomy, appendectomy, those surgeries, do you guys know what they are? Just give me a yes or a no down in the comments. Okay, awesome. So, so cholecystectomy with T-tube in place. Some of you might not be familiar with T-tube, but I wish you can guess. You know, when we say cholecystectomy and with a T-tube in place, you can guess what a T-tube is. Which statement by the client indicates to the nurse the need for further teaching? Okay, so I'm looking for a wrong statement. It will be great to finally get home, take a shower, and wash my hair. Okay, do I need to do further teaching? Is this a wrong statement? 2, if the amount of drainage increases over the next several days, I would call my healthcare provider. Is this true or false? I can resume swimming laps 3 times a week in a pool. 4, I will check the skin around the tube once a day to see how it is doing. What do you guys think? If you try to use cancellation strategy with every single question, narrow the options down to 3 or 2, that would be awesome. So what do you guys think? My voice is not on point today. I have a heartburn for some reason. Maybe I drank too much coffee today. Oh my God, it's killing me. Alrighty, so whoever answered so far or not. So most of you got the right answer actually. So let me see. I'll wait a couple of seconds for those who want to participate and answer. Because you know, like when you answer and interact, the webinar would be fun. Not fun for me, but fun for you. It's always fun for me. Alrighty. So the correct answer is actually number 3. Okay. Definitely, the patient cannot swim. They cannot soak. They cannot soak their surgery site or T-tube in a pool. Definitely, they cannot. So they can shower, but they cannot use a bathtub. Okay. So they can shower Definitely when they shower, they cover their wound, the surgical wound, but they cannot bathtub and they cannot soak their surgery site with water. Okay, that's always an education piece that you need to let your patient know. So basically, the rest are true, but this is the only wrong answer. So if you want to learn more about education for a patient with cholecystectomy, basically 1, 2, and 4, these are things that you tell the patient to do. Signs of bleeding, look for drainage. If it increases, inform your provider. Look for signs of infection, which is number 4. And yeah, when he gets home, he can take a shower, but you tell him you cannot take a bath and you cannot swim, of course. All right. So I'm gonna show you what a T-tube drain will look like for some of you who do not know. So cholecystectomy is the removal of the gallbladder. Okay, they will take out the gallbladder, and a T-tube is a drain that that they put in the what do you call it, in the hepatic ducts. Okay, sometimes there's an obstruction in the gallbladder, or obstruction um, in the hepatic ducts. So you put a T-tube to facilitate the drainage of bile. All right, it looks like that. This is the hepatic tube. This is the liver. This is the pancreas, the yellow thing here. Are you ready? Awesome. The nurse provides care for a pregnant adolescent client during the first antepartum visit. Does all of you guys know what antepartum is? Just give me a yes or a definition in the comments. Do you know what antepartum is? Let me see. Come on, guys, faster. Do you guys know what antepartum is? It could be no. I'll explain it, but I need. Awesome. Yes. So it is right after delivery. Yes. So antepartum is right before delivery or just before delivery. The nurse prepares a teaching plan for the client. Which instruction is most important for the nurse to include in the plan? So you could have multiple correct answers, but I want to know which is the most important at that stage, okay? Not at the later stage, at that stage, just before delivery. Inform the client that the benefits of breastfeeding. 2, instruct the client to watch for the danger signs of preeclampsia. 3, advise the client of the importance of consistent prenatal care. 4, discuss with the client the need to increase iron in the diet. What do you guys think? What do you guys think? Well, antepartum is before surgery, before delivery, not just before delivery. It's before delivery. What do you guys think? Do I have answers? So this is not select all that apply. This is one answer. Do you guys have answers? Let me see. Alrighty, so the correct answer is actually number 3. So advise the client of the importance of consistent prenatal care. Okay, early and regular prenatal care is the best way to ensure a healthy outcome for both the mother and the child. This is a key information to convey during the first visit. So let's go ahead and double check. Let me see. Let's go ahead and double check. Let me share. Let me see. Let me share my Google with you. Alrighty. What is it we're looking for? What is it we're looking for? Antepartum. Come on. Okay, there you go. Occurring not long before childbirth. That's antepartum. Let's see images. Definition: antepartum defines bleeding. Nah, I'm not looking for that. Let's see. Pregnancy timeline. Postpartum. Intrapartum. Oh, the intrapartum is just or during labor and delivery. Antepartum is all the way from conception all the way till labor and delivery. So it's 40 weeks. Okay. You know, for some reason, I thought antepartum is just before delivery right here. So I had the definition wrong. But hey, that's why we have Google. Okay. And that's why you have Google. Let's see. Okay. So prenatal care is going to the visits, taking prenatal vitamins, doing prenatal lab tests like the torch and stuff, doing prenatal or ultrasounds prenatal like at 12 weeks, 20 weeks, and 34 weeks. These are the prenatal care. Just to be on top of your blood test, your urine test, your what is that? Your multivitamins, your iron, your calcium, whatever you take during your pregnancy. Okay. All right. So so the correct answer is number 3. Okay. See, if you know like proper definition of the what is that? Oh, that's a different question. Where's the nurse provides care for pregnant adults and client during the first. Oh, did I erase the word? Okay, so anyway, so you guys know the question, right? All right, let's move on. The nurse talks with a child who has been sexually abused by a family member. The child asks the nurse, "If I tell you something, will you tell anyone my secret?" Which response by the nurse to the client is appropriate? I hope you guys will answer this right. Because like communication questions are very important, and by now you should know how to answer. All right, number 1. I will not tell anyone your secret. Number 2, I'll not tell your mom and dad. Number 3, I'll call the nursing supervisor as a witness. 4, I cannot keep this information a secret. What do you guys think? Let me see. Let me see. You know, when you interact and you get right answers, you gain my trust. So like whoever is attending this webinar, I literally know who are the people that I can trust that they are doing a good job, they're studying, they're on top of things, and they're gonna pass. I mean, eventually everyone's gonna pass, but yes. All right, awesome. See you guys. Awesome. So this is the thing. We have 2 teams, team option number 2 and team option number 4. Okay, so some are saying, I will not tell your mom and dad. Well, what happens if his dad is abusing the child? Because the child has been sexually abused by a family member. What if the dad is the abuser? What will you do? You're not gonna face the dad? You're not gonna confess? You're not gonna call child services? Of course you will. So basically, number 2, you're lying to the patient, and you cannot lie to the patient. Okay. So correct answer is actually number 4. I cannot keep this information a secret. You have to be honest with the patient, okay? You tell them, first you say that you cannot keep this information a secret, but you'll make sure that he will be safe. And you will only share this piece of information with people who care for him and who are part of the multidisciplinary team. Okay, multidisciplinary team could be doctors, pharmacists, dietitian, social services, whatever the case is. Everyone that takes care of the patient and his care is in the multidisciplinary team. So you should tell the patient, I cannot keep this information secret, but I promise that we'll make sure that you are safe, and we will only um, tell this information to people in the multidisciplinary care or multidisciplinary team. Okay. A group of clients are identified as at risk for pressure injury. For which client does the nurse initiate pressure injury prevention measures? Select all that apply. Oh, you know what? I wanted to put a slide about the Braden scale. I think I forgot. But anyways, number one, a client in skeletal traction who is diaphoretic. And I hope that everyone knows what diaphoretic means by now. Number two, a client with redness areas that are blanch or blanchable on both elbows. Three, a premature neonate with nasogastric feeding. Four, an infant who had surgical repair of an umbilical hernia. Five, a client who has a temperature of 103 or 39.4. Six, a client with urinary retention who self-catheterizes. Basically, some options are totally irrelevant. You can just go ahead and cancel them. And some are options that I would keep, till the end or for the second round. So what do you guys think? Alrighty. Show me your options, guys. Put your options. Alrighty. All right, I'll wait for one more option. Okay. So, like everyone included number two. Everyone, literally, like everyone included number two in their option. Number two is wrong. And the reason is the word blanchable. Blanchable means that if you press on the red spot, it will blanch white. And then if you remove your hand, it will go back to red. If it's blanchable, that means it's not a bed sore. Okay, it's not a pressure ulcer or pressure injury. If it's blanchable, it's not a pressure injury because there's still perfusion. Okay, anyone, if you sleep on your, if you are sitting watching TV and you're sleeping on your side, if you switch positions after like an hour or 2 hours, your elbow would have a red blanchable area. That doesn't mean that you are at risk for injury. Okay, so number one, skeletal traction. Okay, risk for injury is not just a pressure ulcer. Okay, any pressure injury. So if you have a skeletal traction, you have pins inserted into your bone, that means that you are at risk for injury. Okay, if you have an NG tube for a premature patient, or even an infant, or even a pediatric patient, if you have an NG tube, then you have a risk for injury to the skin at the nostril site. Okay, that's why you change tapes of the NG tube and you put like a protective tegaderm, you know, where you tape your NG tube, because there is a risk for pressure injury from the tube to the nostril. Basically, all the answers. So someone chose number 4. So that this umbilical hernia, there's no risk for injury. This might be risk for infection, but not injury. Okay, the patient had an operation. So fever and self-catheterization, I would cancel those right away. Are ready? Awesome. All right. The nurse provides care for a client during a wellness visit. The nurse teaches the client about the effects of stress. Which statement by the client indicates that teaching was successful? Number 1. If I do not do something to relieve my stress, I'm putting myself at risk for cancer or infection. So you want to ask yourself, is this true? You're looking for a true statement. So is this true? Number 2, my blood sugar levels decrease when I'm stressed, putting me at risk for hypoglycemia. Immediately you ask yourself, is this true? I'm looking for true statements. Is this true? Number 3, anti-anxiety medication are the only effective way to reduce my stress. Is this true, Mo? Mo, is this true? 4, I will sleep my anxiety away. So like when he sleeps, his anxiety, he will relieve his anxiety, or she will relieve her anxiety. Is this true? All right. So ask yourself, and then what is the true statement, or what is the closest statement to be true? What do you think? What do you guys think? Who has an answer for me? Come on, guys. Do you have an answer? Alrighty. So the correct answer is actually, who can sleep their anxiety away? Like if you're anxious and stressed, if you sleep, it will go away. Let us say you're stressing, you have financial stresses. If you sleep, then the next morning the anxiety will go away. Or if your kid is sick and you're stressing about it, if you sleep, when you wake up, your anxiety will go away? I don't think so. Number 2 is actually the opposite. Number 2, if you are stressed, you'll have hyperglycemia. If you are stressed, you'll have hyperglycemia. Okay? So basically the correct answer is number 1, sorry, number 1. So if you do not deal or handle your stress, you're literally putting yourself at the risk for immunodeficiency. Okay? Immunodeficiency. And once you have low immunity, you'll get not just like infection or cancer at a like stupidly high levels of stress. Okay, you'll go into severe immunodepression, and then your own cells will turn against each other and they will mutate. But definitely, if you are stressed and you do not deal with your stress, you'll get immunodepressed to a point where you'll get sick all the time. You'll get like abdominal symptoms, you'll get respiratory symptoms, flu-like symptoms, you'll get infection everywhere. Okay, so basically, yes, you need to handle your stress. And stress is not only medicated by medication or treated by medication. There's yoga, there's meditation, there's social workers, there's psychologists, depends what is causing your stress, okay? The nurse observes the parent of an adult client crying in the waiting area. Okay. The parent says to the nurse, "My father died of meningitis, and it was awful. Now my child may die of the same thing." Which is the best initial response by the nurse? And this is a very good question actually. This is an NCLEX question. One, the outlook for meningitis is better now than it was then. So this is the nurse's response. The nurse is saying the outlook for meningitis is better now than it was then, meaning that treatment for meningitis now is better than it was, whenever your father died. Two, I can have the chaplain come speak with you if you like. Three, this must be bringing back a lot of memories. Four, not necessarily. You cannot make that assumption. What do you guys think? Just try to stay away from judgments and personal opinions. Facts are good, and addressing, emotions, fears is also good. But definitely try to stay away from judgments or personal opinion, personal experiences. Alrighty, what do you guys think? Come on, let's wake up. Let's wake up, everyone. Let's wake up a little bit. Come on. Give me answers. Okay. Good. Good. Alrighty. Actually, the correct answer is number one. I know. Hey, listen, I know. I want to choose number three. I want to choose number three. Period. So if you chose number three, that's me. Okay, all day long. But the correct answer is number one. Okay, that's why we put the question here. Misleading myth or misleading conceptions or misconceptions. So that's a fact. Treatment for meningitis or TB or whatever the disease is, cancer, 20 years ago, way different from treatment nowadays, right? So treatment has improved, studies have improved, research improved. So it's not necessarily the case that the patient's gonna die, the baby's gonna die just because of his grandfather died of the same situation, right? So number one is correct. Number two, I would stay away from it because, as we said, we do not call the chaplain to come to the unit. Okay? If this is done overseas, it's not done in the United States. The chaplain in the hospital, they have an office. They have like a small church. I don't know what they call it, but I see the sign in the hospital I work at. It's called chaplain this way. Okay? So two is no. Three, I might choose it. I might leave it. Number four, I would not choose that because it has a feeling of judgment in it. Because not necessarily you cannot make that assumption. It's like you're judging. Okay. I would like to educate the patient maybe or address his feelings instead of stating a judgment. Okay. So I would go between one and three. I would go either or to keep it honest with you. If I was sitting in an NCLEX question, I would choose one or three. I don't know. I can go either or, but the correct answer is number one. All right. All right. So this responds to the parents' expressed concerns and offers factual information, family teaching, of which the parent may not have been aware. This may help elevate some distress, which is true. Facts are good. Okay, facts are good. Judgments, personal opinion is not good. Addressing feelings are good. Alright. A client in labor is unable to get to the hospital because of inclement weather. Inclement. Did I write that wrong? Inclement weather. I think it's right. Inclement weather. And calls the nurse who lives next door for help. Oh, I hate that. I hate my neighbors calling me, to check this and that just because they know I'm a nurse. So once the fetal head is delivered, oh my God, she's delivering the baby. So once the fetal head is delivered, which action is appropriate for the nurse to take? Okay, so she delivered the head. What's her next step? Instruct the client to bear down and push. Bear down and push. 2, turn the neonate's head in a clockwise direction. 3, check the neonate's neck for the umbilical cord. And 4, ask the patient to pant through her mouth, which is to exhale through her mouth. What do you guys think? This is interesting. Do you guys visualize the situation? I can totally visualize the situation. Awesome, you guys got some experience. Alrighty. So the correct answer is actually, as a lot of you have answered, is actually number 3. Okay. So you need to check for the umbilical cord. Once the head is out, because if you deliver the shoulders and the cord is around the neck, then boom, that's it. You can't do anything else. Okay. If you deliver the shoulders and one hand is out, that's it. You cannot push it back. That's why you put your fingers and check if the umbilical cord is around the neck. If it's around the neck, then you push the head back and try to get that cord away, just to free the cord. Okay, so if when the head is out, you check for the umbilical cord right away. Okay, awesome. And now, because we talked about this in the second stage of labor, we're gonna have a slide about the second stage of labor, And we're not discussing maternity slides. During we discussed them once. I told you they are very important. You'll get a lot of questions on maternity. Just make sure you print them out because they are like direct to the point. Print them out, know them, memorize them. We don't have to go over them, every single webinar. And today we're going to discuss some maternity, just to remind you of certain things. So second stage of labor, actually, when you deliver the baby, you deliver the head, definitely. You suction the mouth and the nose, and then you check for the cord if it's around the neck. Okay, and then you deliver the shoulders, the arms, and the body, and instantly, what do you do after that? Okay, yes, you slap the baby on the butt to cry, to activate the lungs. Just move that fluids outside of the lungs or the secretion, and then you put an ID band on the hand of the baby and the hand of the mother. Okay, actually on the leg of the baby, the foot, on the ankle of the baby, and the wrist of the mother. Okay, you make sure that the baby does not go anywhere outside the room without a band. Alrighty? A parent bring a 10-month-old child to the health clinic. The parent asks the nurse when the child will be ready to begin toilet training. Which response by the nurse is accurate? Okay, the parent asks the nurse about toilet training. Which response by the nurse is accurate? Your child is ready now. Your child will be ready in 2 months. So by the age of 1 year, your child will be ready in 8 to 12 months, which is a year and a half to 2 years almost. Your child will tell you when your child is ready. What do you guys think? What do you guys think? What do you guys think? Awesome. Love it. Okay, so it is number 3. Most of you, everyone actually got it right. So child is ready by the age of 1.5 to 2 years, because that's the time when the urinary sphincter is fully controlled by the child, or is fully developed to be controlled by the child. All right, awesome. While the nurse irrigates a client's NG tube, the LPN, or LVN in California, approaches the nurse to report. Let me see again. While the nurse irrigates the client's NG tube, an LPN approaches the nurse to report that a different client is hemorrhaging from the rectum. Okay, so the LPN went into another patient's room to talk about another patient that he is having critical situation, which is hemorrhaging. Which action by the nurse is most appropriate? Okay, number 1, instruct the LPN to take over the irrigation of the NG tube while the nurse assesses the other client. Manage the bleeding client, or the client who is bleeding, and then discuss with the LPN why this was a HIPAA violation, because the LPN was discussing patient information in front of another patient. So I don't know if you would consider it as a HIPAA, because in the question it literally said that the patient approaches the nurse and report that report. So it didn't say that she was whispering, but again, approaches, we'll see. Number 3, ask the LPN to obtain the client's vital signs and immediately report them. Ask the LPN to obtain vital signs and immediately report them. Number 4, tell the LPN to find another nurse and report about client difficulties. What do you guys think? I would cancel 2 right away, and I'll be confused between 2. What do you guys think? Do you think this is a HIPAA? You guys think this is a HIPAA? Let's see. Do I have answers? Oh my God, someone, oh my God. Oh, I didn't think that anyone would answer that. I don't know why. I actually didn't think that anyone would answer that. I am literally surprised. Okay, I'll wait for one more. You know who you are. Just put an answer. I want to see your critical thinking, your mindset. All right, I'm waiting on you just a few more seconds. Put your answer. Just give it your best shot. Give it your best shot. Alrighty. So let's go ahead. Before I reveal the answer, maybe other people will answer, but let's try to analyze them. So the first one, the LPN to take over the irrigation of the NG tube while the nurse will go and assess the client. I mean, for me, this looks right. Okay. So LPN can take over because NG tube feeding or irrigation is under her scope of practice, and the RN is supposed to assess hemorrhage. Okay, that's an unstable patient, new complication, unexpected signs and symptoms, and the nurse should go and assess. For me, this look true, unless there's a better option. Okay, number 2, manage the bleeding client by the RN, obviously, and then discuss with the LPN HIPAA violation. Okay, so if you know what HIPAA is discussing patient information in front of another patient. Okay, so in this case, did the LPN discuss patient information? So did she reveal the identity of the patient? For me, I would keep this option, but I don't think so. I don't think that there was a HIPAA violation. Okay, because the LPN did not use a name, did not use a room number, and did not use a diagnosis. So what she did, she said patient is hemorrhaging from a rectum. And if you hear that, you cannot tell, oh, this patient is in room 303 or this patient is Paul Smith. Okay, so I'll keep it, but I don't think so. Number 3, which most of you guys answered number 3, I would cancel this right away. Like, this is an urgent situation, need to be addressed right now. So why do I want to assess vital signs? What's the benefit? Are you looking for hypertension and tachycardia? I mean, that's expected, right? So it's expected if the patient is having hemorrhage from the rectum, means that he's bleeding inside his rectum, definitely he's going to have hypotension and bradycardia if the hemorrhage is severe. So I don't know what you got. Why should I delay intervention or assessment? You know, because irrigating an NG tube is not more important than addressing the bleeding patient. And same thing for number 4. I won't send the LPN somewhere else to look for another nurse, and that will waste time for a way more priority patient then. So basically, I'll choose number 1. Okay, I'll choose number 1. I don't think there was HIPAA violation in number 2. Okay, so let's very quickly review the acts or act violation that you need to know for your NCLEX. There's 4 of them, I believe. First one is the Patient Self-Determination Act. When a patient is admitted and you do not give the patient information about advance directive, every single time when a patient is admitted, you should ask them if they have any change in the advance directive. And if they do not have advance directive, then you should initiate one. Okay. Number 2 is the EMTALA, Emergency Medical Treatment and Active Labor Act. Basically, anyone in the United States should be offered treatment no matter what, doesn't matter his race, his skin color, his financial status, if he has money or not, if he's socially acceptable or not, if he's crazy, psych patient, it doesn't matter. Any human being in the United States should be offered treatment if he asked for it. All right. So, and then you've got the HIPAA, which is unapproved sharing of clients' information. And then you've got the National Organ Transplant Act. No, I mean, in the United States, you cannot sell your kidney. Okay, you can donate. You cannot sell your kidney to another person, like an agreement between you and him. That's not allowed. I know, like overseas, like in the Middle East, that's totally acceptable. You can go to Pakistan or India and sell your kidney or buy a kidney. That's totally acceptable, but not in the United States. Alrighty. So a healthcare provider removes the peripherally inserted central line, which is a PICC line, from a client. A portion of the catheter breaks off. Oh my God, this is the worst situation ever. Which action does the nurse take first? Okay, you've got the tip of the catheter, it's migrated inside. So it's broke. So what do you need to do immediately? Check the client's radial pulse, turn the client to the right side, apply a tourniquet to the upper arm, and 4, instruct the client secretary to call for an emergent x-ray. What do you guys think? What would you do if you're removing a PICC line and then the tip of the PICC line broke and it went inside the vein? What do you guys, what would you do? because then with every heartbeat, every pump of the left ventricle, that catheter will migrate further towards the heart. So what do you guys think? What should you do? Let me see. What would you do? Okay, I'm gonna give you like a few more seconds. All right, awesome. So the correct answer is actually number 3. You apply a tourniquet. Okay, you apply a tourniquet, but at the same time, you make sure that there's still perfusion to the hand. But definitely you apply a tourniquet because that vein is superficial and you want to make sure you occlude it completely. You occlude that vein completely. But you don't want to put pressure on the arteries because you still want perfusion to the hand, and you want the blood to go back. So you put the tourniquet in a way that it's not extremely tight, that it's not allowing the blood to perfuse into the hand, but you put it in a way where it's tight enough to block that vein. Okay, awesome. So a client diagnosed with MRSA, methicillin-resistant Staphylococcus aureus. So a client diagnosed with MRSA wound infection has a chest X-ray prescribed. Which arrangement does the nurse make for this client to do the X-ray? By the way, MRSA patients will receive mycin, aminoglycosides, as antibiotic, okay? Because this is a serious infection. They receive mycin. So any mycin that has throw in it, like erythromycin, zithromycin, does not treat MRSA because MRSA is serious infection. So how do I perform the chest X-ray? Transport the client by wheelchair to the radiology department. Okay. Want to think about MRSA patients. Are they isolation? What type of isolation? Number 2, transport the client by stretcher to the radiology department. So the first one is a wheelchair, the second one is a stretcher. 3, arrange for a portable bedside X-ray. And 4, contact radiology to cancel the X-ray. What do you guys think? What do you guys think? Do I have answers? Do I have answers? Okay, let's see. All right, awesome. Well, I like the critical thinking. All you got it right. It's portable bedside X-ray. Does anyone know MRSA is what type of what type of transmission-based precaution? Just tell me in the comments. Do you know what type of isolation is MRSA patients or are MRSA patients? Just put it down in the comments. Do you guys know? Awesome. Yes, don't be afraid to answer. It is contact. All right. I have to fix a slide, I believe. Just give me a second. Let me see. We still have like oh no, actually. Yeah, actually this is the last question. But hey, don't go away. We have very important slides that I need to explain. Are you ready? Okay. So this was the last question, and I truly like the fact that you guys guessed or know that MRSA is contact. That means that you are aware that MRSA is contact. I would like you to memorize all those diseases and what type of isolation you need to choose. All right. So are you guys familiar with this, what do you want to call it, with this, oh, it's written there. Chest draining system. Okay, so this is a chest draining system. All right. I want to make sure if you guys are familiar with the different parts of the chest draining system. So basically this will be attached to a chest tube, and I want to make sure that you guys know the different chambers in the drainage system. Okay, so let's explain them. Suction control. This is a suction control switch, and if you see on the other side, this is from the other side. Okay, this from one side. This, if you flip it to the other side, this is the other side. This is the suction control chamber. Okay, this is the switch, this is the chamber. Drainage chamber. This is the drainage chamber. Usually it's the last chamber. Okay, so they name them like A, B, C, and D or whatever. Usually the last chamber is the drainage chamber. It's the D. Okay. Do I need to know anything about the D? There's only one thing you need to know about the drainage chamber. Okay, what does drainage chamber means? It means how much is the chest tube draining. So what's acceptable in the first 12 hours after a thoracic surgery is 100 mLs per hour. Okay, so if it's 100 ml or lower, then that's fine. And I think no, not for 12 hours, for the first 4 hours actually. So if it's 100 mLs or lower, then that's fine. If it's higher than 100 mLs, then the patient is bleeding. You need to let your provider know. Okay, that's all you need to know about a drainage chamber. You observe how much the patient is draining and what's the color of the drainage. All right. What I'm concerned about, or what I want to teach you from this slide, is actually the suction control chamber and the water seal chamber. Okay, you will get questions about bubbling. They will tell you there is continuous bubbling in the suction chamber. There's continuous bubbling in the water seal chamber. What does that mean? Or they will tell you there is intermittent bubbling in the suction chamber, or there is intermittent bubbling in the water seal chamber. Okay, so you need to know what's normal, what's abnormal, and how to fix the abnormal. These are NCLEX questions, guys. Okay, so we're gonna get the slide, and you're gonna memorize it forever. We might not have questions about chest tube, troubleshooting or different, maneuvers with chest tube, but literally, it's one slide. Memorize it, okay? All right, let's go. Chest tube troubleshooting. First, if you have bubbling in the chest tube, okay, and I don't mean the chest tube, I mean if you have bubbling in the drainage system, you need to ask yourself, where is the bubbling? Okay, if you have a bubbling in the chest tube drainage system, you need to ask yourself, where is the bubbling? Is it in the water seal chamber, or is it in the suction control chamber? Okay, is it in the water seal, or is it in the suction control chamber? If it's in the water seal, then you need to ask yourself another question. Is it intermittent or continuous? Intermittent, no problem, that's normal. All right, no need excuse me, no need for intervention. It's normal. Continuous, there's a leak. That's it. That's it. Continuous, there's a leak. You find the leak, you tape it, you fix it. Unfixable, change the chamber, change the whole drainage system. But if you can fix it, you just tape it. So again, chest tube, you're gonna ask, where is the bubbling? Is it in the water seal chamber or in the suction control chamber? Water seal, you ask yourself, is it continuous or intermittent? Intermittent, no problem, that's normal. Continuous, you find the leak. All right, so what if it is in the suction control chamber? What if it is in the suction control chamber? You ask yourself, is it intermittent or continuous? If it's intermittent, that means the suction is not enough. You need to put more suction. You need to increase the suction volume, okay? Usually doctors order, like I want suction on plus 20. So you adjust it to plus 20. If there's intermittent bubbling, you do not adjust it to the suction because that's a physician order. You call your physician and tell him, hey, there's intermittent bubbling in the suction control chamber. What do I need to do? How much do you want me to increase the volume of the suction? And then he'll let you know. Okay? If it is continuous bubbling, perfect. That's normal. All right. Is this hard to master? Let me know that down in the comments. Is this easy or hard to master? Let me know. You're gonna get a question in the NCLEX. One question is gonna talk about chest tubes. Okay? Is this hard? Easy information? But hey, if you didn't know, your anxiety will build up, start sweating, and then you start worrying about it, right? But it's easy. I just want you to, memorize the picture, have that visual image, and ask yourself those questions. And that's it. I don't want you to mix up. Memorize it. Read it every day. You're going to have one question on the NCLEX. All right? Now, we're going to have a few slides. We're going to talk about labor and delivery complications. How do I need to treat them? And again, simple method to memorize them. Okay? Just memorize them, and you're going to tell me if it's easy or not. Let's go. All right. Signs of uterine tetany or uterine hyperstimulation. What is uterine tetany or what is uterine hyperstimulation? The second one is obvious. Uterine is uterus, hyper is extra stimulation of the uterus. So stimulation of the uterus more than what's needed. How do I translate that into labor and delivery, into a pregnant woman? That means that the patient is having contractions for more than, if you remember, for more than 90 seconds. Okay, my cutoff is 90 seconds. If a patient is having contractions and they are lasting more than 90 seconds, that means there's a problem. You inform your provider. If the patient is having contractions back to back with less than 2 minutes apart, then there is a problem. You call your provider and let her know. Okay? So let's repeat. Uterine tetany or uterine hyperstimulation is hyperstimulation of the uterus. That means the uterus is being or is having a lot of excitation, a lot of contractions on the uterus. So the normal is a contraction less than 90 seconds, and 2 contractions back to back should be more than 2 minutes apart. So if you're having a contraction for more than 90 seconds or the consecutive contractions are less than 2 minutes apart, then you call your provider and let them know. Okay? So let's see. If your patient is on Pitocin, what do? So you're giving a drug to increase contraction or to synchronize contractions, put them in a rhythm. If you're giving Pitocin and the patient is having more than 90 seconds contraction time, or the 2 consecutive contractions are less than 2 minutes apart, what do? Let me know in the comments. If your patient is receiving Pitocin and you're having this complication, what do? Come on, faster. What do? You stop it. Yes, amazing. Everyone answer at the same time. Yes, you stop it. Easy, right? Okay, so if that's an option, so if this is a scenario of the question and they ask you, what do you do? Easy. You pick up this option. You stop it. All right. So before informing your provider, you stop the Pitocin and then you inform your provider. Okay. First you act and then you pass the bucket. So contractions should not be longer than 90 seconds or less than 2 minutes apart. Okay. So how do I know the time of contractions? How do I know? Okay. So contractions, I have different characteristics for them, right? Frequency. The frequency is from the beginning of one contraction to the beginning of the next contraction. That's a frequency. I count how many contractions I'm having. Duration, which is my interest, okay, I want to know how long is the duration of one contraction. So how do I measure it? Okay, I measure it from the beginning of the contraction to the end of the same contraction. Okay, so as soon as the curve starts to go up, and then it goes down. All right, and I'll draw a picture. But the last characteristic of a contraction is the intensity. The intensity means how is the patient feeling it? Is it painful? So intensity, how strong they are, and of course this is subjective. And how do you palpate the fundus? Okay, how do you palpate the fundus? You palpate the fundus with your hand. You palpate with your hand and your fingertips. You walk over the fundus and try to feel it, if it's hard or not. Okay. So let me grab my highlight for a second. Let me grab my pen. Let's see. So when we talk about duration, which is my interest, I want it less than 90 seconds. This is the graph. This is a contraction. It starts here and it ends here. This time should be less than 90 seconds. Okay, and then let's say this is the beginning of the second contraction. Then from here to here is the frequency, from the beginning of one to the beginning of the next contraction, from here to here. Okay, if this begins, then I already have two contractions. All right. Alrighty, let me clear this. Still have a few more slides to share with you. Alrighty. So we discussed those. I want you to memorize them. Already, complications. Painful back labor or painful back pain, lower back pain. How do you treat it? How do you treat back pain? And I bet every single one of you know how to treat back pain. You tell the patient to walk, right? If the patient, her water broke, and we already discussed this in the past, if her water broke, then she's bedridden. That's it. You do not ask the patient to walk again. You will put her on bed rest and you put a Foley catheter for her. Because if she walks, she's putting the baby at risk for a cord compression. Okay? So painful lower back, you ask the patient to walk, or they can lean forward on the side of the bed and the spouse or the husband or the nurse can massage her lower back or put heat pads. Okay, so all of these are correct information. If you see them in the answers, these are correct information. You ask the patient to walk. If she's not able to walk, let's say she's having a contraction, she's not able to walk, and she leans forward on the side of the bed, face down, lean forward, and then you massage her back with your fist or you put a heat pad. Okay, so let us say that her water broke and she's having back pain, lower back pain. What do you do? Okay, so she's bed rest, so you reposition and put her in a push position and put her chest or her head towards her knees, or chest towards the knees, or actually the knees towards the chest, and lean the head a little bit forward, just like she's pushing position, like she's delivering the baby. Okay, so that's position you want to put the patient in if she is bedridden, her water broke, and she's having lower back pain. Okay, prolapsed cord is presenting, and which is it's wrapping the baby's neck. Okay, that's also a complication. What do you do? What do you do if you saw or you felt that the patient has the cord around the neck or prolapsed cord? What do? You push the head to the inside of the cord and try to release the cord, okay? Or you push the head towards the cord and you ask the mother to position in a knee chest position, okay? Just to be able to push the baby a little bit and move the cord, okay? Interventions for all other complications are lion or Leon. I don't know why I pronounce it Leon, but Leon or lion. L is you put the patient on the left side. I is IV fluids, increase IV fluids. O, give oxygen and notify your provider. So if you see lower back pain in different situations, if the patient is bedridden or if the patient is mobile, this is how you treat it. Okay, if the patient has a prolapsed cord, this is how you treat it. Any other complications, which we're going to talk about, you treat them with Leon or lion. Okay? Left side, IV fluids, oxygen, notify physician. If the patient is on Pitocin, what do? You stop the Pitocin and then you perform Leon. Left side, increase IV fluids, oxygen, notify your physician. Okay? Awesome. So if your patient is getting Pitocin, stop the Pitocin and then do Leon. Okay. So fetal monitoring patterns. Fetal monitoring patterns. Actually, I wanted to explain another slide before this slide, but it's fine. Let's go. Or you know what? Let me just fix that real quick, just to keep our, like thought process. Oh, I have a missing slide for some reason. Oh no, it's there. It's there. Okay. Yeah, I've prepared those slides a long time ago, so okay. Let's go. So complications, right? We talked about them. You gotta memorize them. That's all. So fetal monitoring patterns. What is the normal fetal heart rate? Does anyone know what is the normal fetal heart rate? You guys know? Just put it down in the comment section. What's the number? Normal fetal heart rate. Do you guys know? Or an estimation. Fetal heart rate means that the baby is still in the patient's. Awesome. Okay. Alrighty. 120 to 160. Perfectly fine. So low fetal heart rate under 110. What do? You stop Pitocin and perform Leon or lion. Okay. Stop Pitocin and put the patient on the left side, give IV fluids, oxygen, notify provider. Okay, it's that easy. So if in the options they're saying select oral apply, and they're saying put the patient on the left side, another option is saying put a nasal cannula, 2 liters of oxygen. There's an option saying hydrate patient, and there's another option saying notify your provider, and there's an option saying put the patient in a chest knee position. Okay, what do you choose? Chest knee position? No, I'm gonna put the patient on the left side and choose all the other stuff, right? So if you just memorize this, stop Pitocin, Leon, then that's it. You'll get that question, select all apply, and most of these questions are select all that apply. So you'll get that select all apply question with just one word, Leon. Leon and stop Pitocin. Okay, awesome. So what's a high fetal heart rate? High fetal heart rate is over 160. Do I need to intervene? Do I need to do anything? No. Okay, so my only concern is a low heart rate, below 110. All right, now we have a formula for maternal complication with the mother. Okay, so what's the formula? L's and V's are dangerous. What does that mean? Everything that starts with L, so a situation that starts with L, like late deceleration. Okay, it starts with L, right? So late deceleration is a dangerous situation. What do I need to do? Leon. So L, Leon. Of course, if there's Pitocin, stop Pitocin. V's, Leon. If there's Pitocin, stop Pitocin. Is that easy or what? L's and V's are dangerous if a situation starts with L, like late deceleration, you stop Pitocin if there's Pitocin, and Leon. Left side, IV hydration, oxygen, notify your physician. Okay, V's, same thing. Okay, variable deceleration. What do you do? Same thing. Leon, stop Pitocin. All right. So this is like the formula, with heart defects and newborns. Like trouble and no trouble. It's as easy as that. So let's see some of the diseases. So any position that starts with L, perform Leon. If it starts with V, you perform Leon. But if it starts with variable, you put the patient in push position. Okay. So let's see. Low baseline variability. What do you think? What do you do? Tell me in the comments. So L's and V's is dangerous. You perform Leon. What do you do with low baseline variability? Tell me in the comments. Is that easy or what? Leon, right? If the patient is on Pitocin, you stop Pitocin. Okay, let's see this one. High baseline variability. What do you do? High baseline variability. What do you do? Tell me in the comments. High baseline variability. What do you do? You don't do anything. That's normal. Okay. What's the rule? It's L's and V's. Did we talk about any H's? No. H is normal. Any other letter is normal. So L's and V's. Okay. Variable, you do push position. If it starts with the word variable, you do push position. Starts with V, you perform Leon. L, Leon. H, that's normal. Okay. I don't want you to worry about it. Let's see this one. Late deceleration. What do you guys think? Late deceleration. What do you guys think? Leon. Yes, Leon. It's that easy. Okay. Let's see. Early deceleration. What do you guys think? Early deceleration. What's the rule? L's and V's are dangerous. Otherwise, that's normal. You don't do anything about it. Okay. You do not do anything about it. Let me see this one. Variable deceleration. What do you do about it? Variable deceleration. What do you do about it? How do you treat this position or this complication? Amazing. Push position. Is it that easy or what? This is what you're gonna see on your NCLEX. This slide. That's it. Slide is finished. Push position. That's it. Okay, you're gonna see a question or two about different position in your first 75 question. I cannot stress enough how important are labor and delivery. But it is like for me to sit down and create a question, put options regarding those. There's no creativity in putting a question. Okay. So just memorize the slide. It's gonna be as simple as that. It's gonna be select all that apply. You just choose your options. Okay. Let's see. OBGYN medication. What are the medication that you need to know? This just like oral diabetics, oral oral anti-glycemic medication. You need to memorize them. All right, so let's see. Tocolytics, they stop labor. Tocolytics, they stop labor. Like what? Terbutaline causes maternal tachycardia. So that's one of the side effects. They cause maternal tachycardia. But what is the function? What does it do? It stops labor. Okay. So let's say you've got a 36-week-old, or let's say 34-week-old pregnant mother, and she started to have contractions. And you put the fetal heart monitor on her, and you're seeing contractions. What do you expect? You expect the physician to order tocolytics to stop labor, because that's an early labor. Okay? So just memorize this. If you're having a similar situation where at an early stage of gestation, patient is having contractions, and they ask you, what do you expect that the physician is going to order? They're going to order tocolytics. Most common medication used on the NCLEX is terbutaline. Okay, make sure you know that. Okay, what other medication does the patient receive? Magnesium sulfate. Okay, side effects, causes hypermagnesemia, making uterine contractions, heart rate, increased blood pressure, increased reflexes, increased respiratory rate, or oh my god, no, this all these are hypo actually. So magnesium sulfate, it is given to stop labor, and they lower. So magnesium sulfate causes hypermagnesemia, which make uterine contraction, which lowers uterine contraction, lowers heart rate, lowers blood pressure, lowers reflexes, lowers respiratory rate, and LLC. Let's Google this very quickly. Let's go through the slide, then we'll Google this very quickly. But I guess that's what magnesium sulfate does. It lowers everything. It's inhibitory. Okay, it lowers everything. But what is our goal? Like, when do I panic? When do I stop magnesium sulfate? Okay, we are like stopping labor. But when do I hold the medication? What's my goal? What's my threshold? Respiratory rate lower than 12, or reflexes. So respiratory rate above 12 is normal. Below 12, then I stop magnesium sulfate. Reflexes +2 is normal. +1, which is hyporeflexia, is abnormal. I stop magnesium sulfate. Okay? All right. And then you've got oxytoxics. Yes, oxytoxics. They stimulate and strengthen labor. Like what? Pitocin. It causes uterine hyperstimulation. Okay, contractions, as we said earlier, contraction more than 90 seconds or less than 2 minutes apart, then you stop the Pitocin. Okay, another oxytocin medication which increases and stimulates the strength of labor is methergine. One of the side effects is that it causes high blood pressure. Okay, that's all you need to know about OBGYN medication. That these are all the medication that are used in scenario questions. Okay, that's it. There's 2 more that you use with fetal. So those are OBGYN medication, but you've got fetal medication. Okay, fetal lung maturity medication. And I guess all of you guys know them. You heard about them. You've got betamethasone. Okay, betamethasone is a steroid. It's given to the mother. It's not given to the child just before labor. It's given IM to the mother just before the baby is born. Okay, and it's very fast absorbing. It goes through the placenta to the child, and it will give effect to his lungs. It will mature his lungs. One other medication, and I know you know it, and this you give it to the baby. So betamethasone is a steroid. You give it to the mother. It causes bronchodilation. It is transmitted through the placenta. The other medication that you give it to the child is Surventa, which is a surfactant, okay, that keeps the alveoli open. You give it to the baby transtracheal. So let's say you slap the baby when he's born, you slap the baby on the butt, and he didn't breathe. You slapped him again, he didn't breathe. Then you put transtracheal Surventa into the baby's trachea. Okay, or let us say he's breathing, but he has low Apgar score. So he's cyanotic or whatever. What do? You give him Surventa, okay? Intratracheal. That's it. That's it. It's that easy. Okay, one more thing. You do not give pain medication to a mother who is about to deliver, okay? Because that will cause a depression to the baby, because it will cross the placenta. So IV medication, they take 15 to 30 minutes to peak. So anything around 30 minutes, you don't want to give it to the mother. Okay, if she's in pain and you think in 30 minutes she will deliver, then you do not give her IV medication. She should be on epidural, and the epidural will be going. But you do not give her extra, like fentanyl or whatever IV medication that they give to pregnant women, okay? So this is the last step I want to tell you. Do not administer pain medication to a woman if the baby is likely to be born when the medication peaks, which is 30 minutes. Okay? I know today's webinar was like dry, okay, but what I want you to know, or what I want you to do, if previously I didn't have like questions picked for the people that I help to pass their NCLEX. I usually tell them like a general rule to solve 75 questions a day, 75 questions to 100 questions a day. I do not want you to do that. You're different, okay? I'm giving you 30 questions a day. What I want you to do is to repeat those 30 questions a day, after we finish the webinar. Just solve them again. And when you finish the 30 questions, just solve them again. So I want you to master those 30 questions. I don't want you to solve 75 or 80 or 100. No, I want you to solve the 30 questions and then solve them again to master them. And if you need to solve them three times, like you're solving 90 questions, just do it again, over and over and over until you master them, because those are the questions that are gonna benefit you on your NCLEX, okay? You want to be as much as familiar with them as possible, okay? That will take us to our quote for today. If you want to make something for yourself, work harder than everyone else. Right, thank you for giving me this opportunity to make a difference in your life. Thank you for allowing me to help you pass your NCLEX. Tomorrow, today I'll be sending the test. This time I'm gonna send it early, and I hope that everyone will submit his tests by Sunday, 6 p.m. because literally it's taking me a lot of time to grade them, draw the performance graph, and try to be thoughtful about the advice that I want to give you guys. Okay, so please treat this exam as if it's your real NCLEX. Listen, you still have 2 more exams. Those exams will literally give you an impression or an indication of your performance on the real NCLEX test. So make sure You give them your best, sit in a quiet environment, use the strategies. I have the strategies laid down for you on the first page of the test. Read it carefully and perform those strategies, and take breaks at 2 hour mark and then at 4 hour mark if it took you more than 4 hours. All right. So I'll start working on them, though it's at midnight. But trust me, I'll stay working till like 3 a.m. So as much seriousness that I'm giving this project or this relationship between you and me, I would like you to give it the same seriousness. Okay. There's 8 or 9 of you who are really serious during this webinar. The rest, I don't know why. Like, why did you bother pay the money and whatever? Maybe they booked their exam at the later stage. They just want the information. They will study later on their own. But there's literally 8 of you who are literally dedicated and attending and solving questions. And I love that about you. Okay. So please, let's continue our journey. There's 1 more week. There's 2 more tests. Let's get the most benefit out of it. And please, if you encounter any test, hear any tip, want to learn about any other situation or question that you faced in the past, like on your past experiences with the NCLEX, and you're still having that debate in your mind, oh, I had that question once and I didn't know how to answer it, please let me know. Please let me know. I'll be able to help you. I'll be able to give you an honest advice. All right? Okay, till tomorrow. Or actually, not tomorrow. We'll see you on Monday. Oh my God. I hate that. I can't talk to you guys until Monday. That's all right. Possibly, I might go tomorrow on the group, the Facebook group. If you are on the Facebook group, I might go tomorrow live on the group, just talk a little bit about few stuff. So if you want to watch the repeat or if you want to attend live, that would be great. All right, until tomorrow or Monday, love your faces and see ya.